For this next video clip on examination basics, we're going to look for pain, stiffness, or weakness impairments that might be affecting our patient's knee flexion. So we're going to start the examination process by having the patient perform the bottom kicking maneuver. Now, if your patient doesn't know what that is, you may have to demonstrate it. So Hannah, what I would like you to do is alternately bend your knees as far as you can, each side just like that. It's called the bottom kick. And we sit back and we observe the motion. Visually, it becomes very clear, very apparently, that the left knee does not flex as far. So our job is to figure out what's stopping that left knee flexion. Is it pain? Is it stiffness? Is it weakness? Okay? So again, I'd like you to try to bend that left knee as far as you can again. Remember, just like the upper extremities, if we see restricted motion, it's our job to quantify that. And do your best job as you can with the goniometer and get a nice active motion assessment of knee flexion. Okay, relax your knee just for a minute. So now we have the goniometric measurement of knee flexion. Now, let's see if pain is stopping full knee flexion for our patient. So Hannah, once again, bend that knee as far as you can. Many times patients will stop their active movement because they know if they move any farther, it's going to hurt. And that's the purpose of an overpressure test. So we deliver just a little bit more passive movement at the end of their available active motion. And if that reproduces pain, we need to ask our clarifying questions in terms of where our patient felt that, what the intensity of the pain was, and what the character of the pain was. Okay? Now, let's see if stiffness, okay, is stopping knee flexion on the right. So Hannah, once again, bend as far as you can actively. Then really relax the leg, kind of drop it in my hand. I'm going to come away from that end point just a little, and then I'm going to repetitively work back toward it, feeling the first and final stop in movement. Now, if we feel an early, firm end feel, and early means it comes earlier than the opposite side, okay, we know that likely there may be an element of knee joint capsular shortening. That capsular shortening needs to be in the anatomical location of the capsule. If Hannah feels pulling up in the anterior thigh, in the quad area, we know that it might be muscle shortening. That's limiting knee flexion. One final thing, I want you to hold your knee right there, okay? Let's determine if there's any element of weakness impairment affecting her ability to fully flex that knee. So I want you to hold there as hard as you can. Don't let me move you. And simply, we just test the hamstrings right in that position. If we're able to easily push the knee out of that position, we know there's a weakness impairment as well.